Bruises are painful and not pretty, but a lot of times they can be avoided. So if you're injecting insulin multiple times every day and you're wondering, how can I stop bruising after taking my insulin? And this is just the right video for you because I've got 8 tips to help you stop the bruising. Stick around till the end, you might very well learn something new, no matter how long you've been using insulin for or how experienced you are. Welcome back everyone, you are watching the Kasana Health channel. If you don't already know me, my name is Sarah. I'm a licensed pharmacist and I'm the co-founder of Kasana Health. Let's dive right into today's topic. What can you do to stop bruising after taking insulin? So while some bruising after injections can be normal, if you find that it happens too frequently, here are my 8 tips to help you reduce those annoying purple bruises that take forever to go away. Number 1, change your injection spots every time. Which means every time you take your insulin, inject at least 1 or 2 inches away from the last spot you injected. Because here's what happens. Every time that needle goes through your skin, it causes a little trauma by puncturing some tiny superficial blood vessels. This trauma to your skin is sometimes big enough to be visible, which is basically what a bruise is. Obviously, if you inject multiple times in the same spot, you're causing an even bigger trauma to your skin and blood vessels in that area, which makes your bruises even more visible. So give your skin some time to heal from that trauma and avoid injecting insulin in the same spot for as long as possible. Areas where you can inject your insulin include your abdomen, upper outer arm, buttocks, and the front or side of the thigh. But remember that insulin works faster when it's injected into your abdomen. Number 2, move away from your belly button. When injecting in your abdomen, make sure to be at least 2 inches away from your belly button because that specific area is tougher and it can also make the absorption of your insulin less consistent. Number 3, watch your injection angle. When you're injecting, make sure the needle is at least at a 90-degree angle with your skin, so it's not on a slant. The 90-degree angle is the best way to ensure you are minimizing the trauma of your skin by puncturing through less tissue and blood vessels. Number 4, ask for shorter needles. The length of your needles is always written on the box, so check what you have. Using 4 to 5 millimeters of length is usually enough. The backstory to this is that years ago they used to teach to use longer needles and to pinch your skin to make sure that you're not injecting in your muscles. Nowadays, no one teaches that anymore, but I mention it because some of you might still be using that older technique if no one's taught you otherwise since. Using the shortest needles means you don't have to pinch your skin when injecting, which by itself will reduce the risk of bruising. Remember, insulin is a subcutaneous injection, which is just a fancy word to say that you are injecting the insulin right under your skin in the layer of fat tissue before your muscles. If you accidentally injected insulin in your muscle, it will be more painful and it will usually leave a bruise. So choose the shorter needles always to avoid this problem. Number 5, don't reuse needles. Don't even try to lie to me. I know because as a pharmacist, I see how often you come by needles at the pharmacy. And I know how long a box is supposed to last if you change your needles every time with your injections. So when I tell you not to use the same needle twice, I'm not trying to sell more and make more profit for the pharmacy. God, I hate it when people think that. Because if you know me at all, you know that I'm here to help you get off your meds and your insulin. The problem with reusing needles is an old needle can bend at the tip and cause more pain, more trauma to the skin, and more bruising. Not to mention that reusing needles also increases the more dangerous risk of causing skin infections. And while we're on the topic, the same thing applies to the lancets you use to prick your finger and test your blood sugar. So please change them after every single use. Number 6, ice it. If you already applied all the previous tips and you're still bruising, try applying ice to your injection spot for 30 or 60 seconds right before your injection. The cold will shrink the little blood vessels on the surface of your skin that can get punctured when you inject, so it can help you avoid that annoying bruise. Number 7, make sure you have a good injection technique. Technique is everything. So go visit a qualified healthcare provider or diabetes educator and ask them to watch you take your insulin shot. They can then give you advice on improving your technique if needed. Number 8, check what other medication you take. Do you take any blood thinners, like aspirin, Coumadin, or Plavix, to name a few? If you are taking a blood thinner, that might explain why you are easily bruising. So ask your healthcare provider or your pharmacist to get some clarity. but please don't stop taking medication without your doctor's advice. There you have it, my 8 tips to reduce bruising after insulin injections. Let me know in the comments below if you try them, if they're helpful, or if you have any other questions. If your question is, can I someday get off insulin, then check out our previous video that addresses that question exactly. Thanks so much for watching, everyone. I'd really appreciate it if you left a thumbs up or subscribe to our channel. Otherwise, take care, stay safe, stay healthy. I'll see you in the next video. I've got 8 tips. That's 7, Sarah. Here is still... It's like someone just farted.